This is an example of simulation and what we would expect for each of the roles that are going to be assigned. I am Lindsay and I'm going to be the primary nurse. Rachel is going to be the orientee, and Andrea is the off-going nurse going to give bedside report in the room.
All right, ladies, we have Mr. Carter here. You doing okay, Mr. Carter? We're just going to get some information, okay? Of powering. Mr. Carter, P68, he did come in with COPD exacerbation, and this is a acute on chronic hypoxic respiratory failure. We currently have him on 2 liters of oxygen. He's hanging around 92%, but he still is short of breath with exertion. And then I have noted some accessory muscle use, and he does appear fatigued. So a little bit of background on Mr. Carter is he does have that history of COPD, also hypertension. He's a 50-year pack smoking history, doesn't have any allergies, full code. He does use this 2 liters of oxygen at home. He came in with worsening shortness of breath, increased coughing, wheezing unrelieved by multiple rescue haler uses. So this morning for his labs, we did get an ABG. He is 7.32 for his pH. His CO2 is 58. His oxygen 62. So he is still showing that mild respiratory acidosis this morning. And also his white count did come back elevated at 12.8. So for my assessment, his vital signs have been stable for me overnight. Then just keeping a close eye on that oxygen and heart rate. He was tachypnic a little bit earlier, and now his respiratory rate has decreased from 32 to 26. His oxygen need increased from 1 liter to 2 liter in order to maintain his SATs at 90, and his breath sounds has remained diminished, and he does have some diffuse wheezes. He is alert-oriented, but sometimes he's anxious and gets tired easily. So recommendations for this shift for me would just keep monitoring that respiratory status closely, encourage him to do his scheduled breathing treatments, and perform pulmonary hygiene. And then notify the provider if that respiratory rate starts to go over 30 again, or that oxygen saturation drops below 88, or if he has some kind of change in mental status. They may be ordering an additional ABG, and they said if conditions got worse, they were going to consider BiPAP.
Okay.
Any questions for?
That's it. Lewis, are you going to do okay?
I hope so.
Okay. We are going to continue to get report, but if you need anything, you just press your call light, okay? I'll make sure it's in reach for you.
Okay.
Hand hygiene. There you go.
Thank you.
You're welcome.
All right, we'll head over to Ms. Reese's room.
Okay.
Hi, Anna Breeze. Hi, Andrea. Remember me from last night? Yeah, looks like you're going better. I have Lindsay and Rachel here. They're going to be taking great care of you today, okay? Yeah. All right, Miss Donna Ruiz, she came in with CHF. She's 74 years old. We currently have her on 3 liters. She's sitting about 94% with that. She has difficulty lying flat, so we've been keeping her up. She has significant swelling in her legs, and she does remain dyspneic with exertion. And unfortunately, that persistent tachycardia. So a little bit about her background. She has systolic heart failure. Her ejection fraction is 25%. She has coronary artery disease and also chronic kidney disease stage 3.
Okay.
She's allergic to penicillin, and she has full co status. So she came into us with this rapid weight gain and worsening orthopnea, edema, and shortness of breath. Her labs this morning did show some worsening renal function. Her baseline creatinine is 1.2. This morning she's at 1.4. Her potassium is at 3.4, magnesium at 1.7, BNP at 1,200. CBC looked good. She does have 3+ bilateral lower extremity edema. She is positive for JBD, and she does have bilateral crapples. So for my assessment of, again, her vitals have improved slightly, but still remained elevated. Her heart rate was at 118. She's hanging right about 108 now. Respiratory rate, again, a little bit better, went from 26 to 22. Same with blood pressure. She was trending about in the 170s systolically, and now is in the 150s. and the diastolically 96. Now she's down to 90. She has remained on that 3 bleeders. Her O2 stats have been stable for me overnight at 94. She has stayed in sinus rhythm. I do have some concerns about her urine output this morning. It was a little bit low over the last 4 hours. She had about 60 mLs. And then her total intake and output over the last 24 hours, she has been positive about 350 mLs of net fluid balance. So again, she appears tired, short of breath with movement, and uncomfortable with lying flat. So my recommendations for her care would include, again, monitor that respiratory status very closely, see if her edema, improves with some of the treatments, watch her urine output. Again, keep her head of bed elevated. If they do ask for any kind of orders for electrolyte replacement, and I notified the provider of the low urine output. He said just to watch it right now. But if that does start to go lower and drop off, if the blood pressure gets worse or her respiratory status declines, they do want to be notified. They are thinking about adjusting her diuretics and also repeating her labs. Okay. You're right.
Donna, is there anything we can get you right now? Okay. Okay, we'll make sure you have your call light, and then we will be back shortly to complete your assessment. See, okay, sounds good. All right, thank you.
Thank you. All right. We'll go over to the next year, Mr. Kim.
Okay.
Hi, Mr. Kim. Andrea here. We're going to give a little bit of report, okay? All right. I have Mr. Andrew down here. He's 59 years old. He was admitted with a small bowel obstruction and type 2 diabetes. He does report abdominal distension, a colicky type of pain, nausea, and vomiting. He's had no bowel movement for the last 2 days, but he is alert minded and he's just uncomfortable. So a little bit of background for Mr. Kim. He does have a history of type 2 diabetes, prior abdominal surgeries. He has no allergies. He's a full code. The imaging they got did show some distended loops in his small bowel that are air-filled, but no free air. The last did show some mild hyponatremia. His sodium was 130. Hypokalemia, his potassium was 3.2. Elevated BUN at 29, elevated glucose at 310, and his white count was slightly elevated at 11.2. He's getting some IV fluids. They did just put an order in to have an NG placed. I haven't had time to get to that yet. So his assessment for me, his vital signs, last heart rate was 108, blood pressure 138/82, respirations 22, his temp was 99. He's 97% on room air. His abdominal distension he does have tenderness in his belly, and his urine output has been a little bit low. His net fluid balance for the last 24 hours was plus 300 mLs. He still remains uncomfortable, even though we'd given him some Tylenol, but he is at risk for worsening dehydration and electrolyte imbalance. My recommendations would be to continue monitoring his vitals, insert that NG tube, and watch his abdominal status. Hopefully, with the NG output and urine output, then things will start to improve with IV fluids. Watch those electrolytes closely and replace as needed. He does have an order to keep NPO at this time, and then the order for the NG is to be placed to suction. The provider wants to know if he has any worsening abdominal pain, vomiting, hypotension, or change in mental status. And then, of course, with his glucose, just maintaining good glucose control.
Okay.
All right.
All right, sounds good.
Here, Kim. We'll be back in to see you here in a little bit.
Hygiene. I'm going to give you your call light, and we'll be back here shortly to do your assessment. All right. Now we're going to show an example of brainstorming now that we've got report as far as the plan, what we're going to tackle first. Okay, so let's talk about our first patient, Mr. Lewis. So like him, I wrote down a couple things. They talked about an elevated white count. So something to consider would be a respiratory culture. See if we can get one of those. Ask the physician if that's okay. So we'll probably have to call about that order. An sodium spirometer might be a good tool to also have at the bedside. We're going to have to do a focused respiratory assessment on him. So like capillary refill, listen to all the lung fields, 6 in the front and then 8 in the back. And then respiratory is on his case, so we'll have to call respiratory if he worsens. He does look like he's got Duonep's ordered PRN, so if he does have increased shortness of breath or wheezing, we do have that order available to us. It does also look like they're starting him on a broad spectrum antibiotic because of the elevated white count, but maybe if we have a culture to see if that's appropriate antibiotic to have ordered. They also have Solumedrol to go ahead and help with his COPD exacerbation, so we'll definitely have to give that as well. Did you have any thoughts on this patient?
Just watching those ABGs, I know that she said that they were in respiratory osmosis. So
Yes, and it does look like it is uncompensated as well, so the bicart's normal. So we will just have to keep an eye on that and see when the doctor wants to repeat those ABGs. All right, so next we have Miss Donna. She has it said that she had crackles in her lungs, so we're going to have to do a focused respiratory and cardiac assessment with her and her CHF. Here where what fields those crackles are present. Did notice she had the weight gain, so we'll look back at her weight on admission and then her daily weight. Check out her swelling in her bilateral lower extremities. Also for her, I would consider maybe a bedside commode, so we'll have to ask the aide if she can help with that. For Lewis, I was thinking maybe a urinal, and then see if we also need a bedside commode for him. Decreased output with her electrolytes. I was thinking because the potassium is 3.4, considering cardiac monitoring, if that's something that they want to do. Yes, I see EKG is stat if need be, and continuous telemetry. So yes, we have to make sure she has her cardiac monitor on.
do you think maybe her electrolytes are off because she's fluid overloaded?
That is a very good point. Yeah, so they're more like diluted. Yep, that is a very, so maybe if we just make that correction with the fluid shift, it could help with that. And then what do we remember about furosemide, the Lasix, when we're given it IV?
You have to get it slow.
Yes, yep, that's one of those medications we definitely have to give slow. So the order says 10 milligrams over a minute, and she's ordered 40. So how many minutes do we need to push it over?
4 then, right?
4, yep. Perfect. And then her definitely strict ISO. So we'll have to make sure she has a chart to keep track of her ISO or something to measure. So we could possibly ask the aide to get her those things as well. All right. And then lastly, we have Mr. Andrew Kim, small bowel obstruction, type 2 diabetes. I do see that he's been complaining of some abdominal discomfort, has been throwing up. And I also notice his potassium is low too, probably from the increased nausea and vomiting. So we might need to consult the provider to see if they want this patient on cardiac monitoring, since we know that is one of those side effects we need to watch out for. Did you have any other thoughts for this patient?
I've never seen an NG place before, so I'll be there if when you do it.
Yeah, perfect. Yeah, we'll definitely have you at bedside for that.
Cool. I'm excited.
All right. So who out of the 3 do you think we should see first?
I'd say
Remember your
COPD.
Yes, it's already yep. Because we have ABGs, airway, breathing, circulation. So let's go see Mr. Lewis. All right. All right. Lewis, how are you doing?
I can't breathe.
You can't breathe. You're having some difficulty?
Yeah.
Okay. I'm going to hand hygiene. We're going to do a focused respiratory assessment. Okay, let's go ahead and get some vitals. Gloves. Okay, it looks like you are 86%. So I'm going to go ahead and titrate to 3.
Like Yuki is like 88 to 92. It was what third?
For their order, it was greater than 88%. So we need to get him above 88%. So with him being at 86%, yeah, we can titrate. 88 to 92 is the parameter. So we'll definitely take a listen. So now he's 89, so he's within parameters, so that's good. Let's go ahead and do our respiratory assessment. Are you okay, Mr. Lewis, if we take a listen to you?
Yeah.
Okay. Can you verify your name and date of birth?
Lewis Carter, date of birth. XXXXXXX.
Perfect. Your IDVN does match. Let me just take a listen to you. And just breathe normal. I hit to go on the side. On the end, and then I'm going to go around and listen to your back. Okay. Okay. We'll listen to your back side real quick. Does it help sitting up on the edge of the bed to breathe?
Yeah.
Yeah. Okay. Just leave. I'm going to take a deep breath for these low bases. Okay. I'm going to have you listen, and then we'll see if we hear the same thing. So they were saying at home you were using your rescue inhaler. How often were you using that?
Like 8 to 10 times a day.
Okay, that's a lot. Did you go through an inhaler?
Yeah, I'm gonna need a refill.
You're gonna need a refill? Okay, so we'll make sure we get that taken care of when you leave. We're probably going to call respiratory. I think it would help with your increased work of breathing. Okay. Calling respiratory.
This is respiratory.
Hi, respiratory. I have a patient, Lewis Carter, date of birth XXXXXX, and he is in bed 1, and he is in here for COPD exacerbation, acute on chronic, and he's having increased work of breathing. He's currently sitting on the side of the bed, and we've had to increase his O2 to stay within order parameters. Is there any way you could come and give him his albuterol nebulizer treatment?
Yeah, I'll be down shortly.
Okay, thank you so much. You can get some wheezing. Yeah. Yep, it's wheezes.
Simple as that. For sure, but yeah, get over. Hi, Mr. Carter. Sneak him around where you can get see.
Then hi, G. Pregnancy. My name's Sierra. I'm respiratory. I'm going to give you your breathing treatment. It's a nebulizer with albuterol. Have you used that before?
Yeah, I think they did it last time I was here.
Okay. Since it's a medication, I am going to verify your name and date of birth and scan all the meds, okay? Can you just tell me your name and birthday?
Lewis Carter, XXXXXX.
Okay, and do you have any allergies?
No allergies.
Okay.
What did you guys hear on your assessment?
We heard wheezes.
Okay, I'm just going to take a quick listen to verify. You're on 3 liters.
So the men's sweet high stuff here. Softitude, the cytometron. And that's
The steroid, right?
yes, the steroid.
So I don't know. Hey, this. I hear wheezes summation. Scan your bracelet. Scanner on lever.
Would you like us to sit the head of the bed up for you?
That would be great.
Okay. You can go to clips there. Just don't win. Got your call light behind you. I don't want you to get a fresher injury. Here you go.
That's good.
Okay. Oh, I think I hear Miss Donna calling out, so let's go over to Miss Donna.
Harder. You're gonna do this as long as they see the smoke coming out, okay? Okay.
Do you want to go see what she needs? And I'll just make sure this patient stabilizes before we leave.
How are you feeling? A lot better. Okay. Just saying, I feel some jitters. That's normal from the theater. Think I heartbeat increased some. Let's see. Keep up and make sure it was nice. Sound cool. Oh, that's running. I'm gonna take a quick listen to you, okay? Okay. And are you able to sit forward for me? All right, it sounds clear in there. Are you feeling better? Yeah. Okay. She sounds better. If you need anything else, please feel free to call me.
Okay, sounds good. So you feel like your increase of work of breathing is starting to decrease?
Yeah, I'm feeling more comfortable.
Okay. We will be back here shortly with your Solu-Medrol. Please call out if you still feel short of breath or anything like that. You can go ahead and check your capillary refill. Okay. Oh, sluggish. Might also call the doctor when he might need some more blood work. Okay. Okay. All right. I'm going to take a quick listen as my reassessment. I actually just did that. It does sound a lot better. No, okay. All right, we'll be right back with your meds.
Okay, there you go.
Thank you. In hygiene.
Julie.
All right. How's Miss Donna doing?
She's definitely not be swelling. Ito. They're respiratory. It's all about what it is. You can still at the pulses. Okay. 92% on the screw leaders.
Calling the aide.
This is the 8.
Hi, could you bring the telly box for Donna?
You're right there.
We're in bed too.
And then, just like his crackles are really very forced.
Okay.
If you want to look there and see what you think.
Yeah, I'll take a listen.
Check it out.
Okay. Thank you. We're going to put a telemonitor on you just so we can see what your heart rate and rhythm is doing, just with your CHF and everything that's going on. Is that all right with you?
Yeah.
Okay.
This is a tally box. Okay, I'm just gonna be redone on your
Gloves. And then we had the Lasix ordered for her this morning.
Oh yeah, a little power.
Yes, everything's.
What heart rate would I be? So
Thank you so much. I need to listen to you. I'm going to do your heart first. Fixed point. Tricuspid. Mitral. Okay. All right, you okay to sit up just a little bit?
yeah.
Thank you. Yes, I do hear those crackles. Got lots of fluid on ya.
Yeah. Suddenly feeling like my legs are really heavy.
Yes. We can also get some pillows to help elevate those legs. Would that help?
Yeah.
Okay. We'll get some pillows to elevate those legs. So I will call the CNA for some pillows. Oh, yes, it does look like you're really swollen. I would definitely say like a +3. Heck. And chapter capillary refill, capillary refill. Do you have sensation in all your extremities?
Yeah.
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 How do you feel about getting her? I'll help you. I'm just elevating legs here. Well, that's better. Good. Good.
36. About 2 lines.
So we got 2 20s. Yeah.
How about an IV?
Yes. So that's one of our, 10 rights is right dose, right route. And so this is a good way to catch that instead of oral, we do need to give an IV, which I think might be in our bulk meds. I don't think I stock that.
Okay.
Yeah, they don't stock it regularly. So we do have that one.
See, do we have undergrass that legal system?
Do you feel like you're breathing okay on those 3 liters, or do you feel like you're still kind of struggling?
I'm struggling. Why are you to sit up?
Yeah, we can sit you up more. Have you been to the restroom recently?
No. No's dust.
Okay.
Was that headache studied
It
you?
makes it easier. Okay. Where's your ID at, Aaron?
I think they took it out last night.
Well, that's gonna be a problem.
Yeah.
But can we call IV therapy? Yes, this is IV therapy.
Hi, we need an IV in our patient's.
Donna Reese, bed 2.
Okay, I'll be right there.
Thank you. While she's doing the IV, we could go back to Mr. Lewis and give him his Solumadrol. Okay. We have to get them bath for now. We can't leave them at the bedside.
The Louise XX. Okay, and I see an allergy van. What allergies do you? She's okay. No latex. Go ahead. Go ahead. And I'm gonna set this here on your bed. That's okay. You're okay?
Mr. Lewis, we're going to give you your meds. Are you okay with that?
Yeah, that'd be great.
Okay. Okay, and hygiene, privacy. Can you lick your
Treatment any better after the yeah, feeling better since the breathing treatment.
Good. We're going to give you something called Solumadrol. Have you had that before or know anything about it?
Can you remind me about it?
Yeah, so it's a steroid. It's a corticosteroid. It helps reduce inflammation, and it's going to help your workup breathing decrease. They use it a lot with COPD or asthma patients. And then we're just going to make sure we monitor your glucose levels because it could cause a little bit of a spike. And so we're just going to keep monitoring that. Do you have any allergies to any medications?
Not that I know.
None that you know of. Okay. Oh.
But I don't love it.
Yeah, you want to get it? I can go grab the supplies to pull it up while you're pulling the bed. Okay, I'll go grab that. Hand hygiene again, the Bible privacy. All right, so I have a needle and a syringe to draw up your medication, and I got flushes as well.
Right? Strong. Oh, good. So pretty. Eric, you're gonna just be a little stiff. Size 1. Yeah, 62.5. This is 125.
So we know we don't need the whole vial. So we can do a little dosage equation where it is have over desired times the quantity.
Can you help me with that? I'm really bad at math.
Yes, absolutely. And if you ever, once you're out on your own and you're done with orientation and you still maybe struggle with a little bit of dosage, you're always going to reach out to pharmacy too.
Okay.
Sometimes I even call them just to double check my math.
Okay.
So we have 125.
Yeah.
And we desire 62.5. And the volume in the vial is 2 mLs. Whenever you do this, have over desired, we have to make sure that we are having the same units. So they both are milligrams. So we should be good there. We will put it in a simple equation where it's desired over half. So desired is what's ordered. That's what we want to give our patient. And that is the 62.5. And then what we have on hand is the 125 milligram. When you're lining this up, you want to make sure the units match. So they both are in milligrams, so we're good. And then we're going to multiply it by the quantity. So what is the quantity on the vial?
There's 2 mLs.
2 mLs. Okay, so 2 mLs. When we do the math, our answer for 62.5 divided by 125 is 0.5. And then we're going to multiply it by that 2. And that equals 1 ml. So that is what we are going to administer.
Ring, ring, ring.
Yes,
This is Ice Therapy.
hi.
Calling to say Miss Ruiz's IV is in.
Okay, perfect. Thank you for letting me know.
Mm-hmm.
Thanks. So Mrs. Ree's IV is done. So we can go back to her after we're done with his meds.
Ring, ring.
Yes, this is Lindsay.
This is clerical. Your patient Andrew Kim called out vomiting.
Oh no.
Are you able to go in there?
We are in the middle of a med pass. Is there any way you could see if the charge nurse or anybody is available to go in there?
Yeah, I'll let her know.
Okay, thank you. Our patient that needs the NG is vomiting right now, so we'll have to go see her shortly. Let's finish this since we're in the middle of a med pass.
Do we want to give them all still, or just want to get the soy metro?
We can give him all. That way he settles and so he's got his azithromycin. Lewis, the doctor did just put in an order also for a sputum culture. So we will get you a little container to collect that. So if you feel like you're coughing up any phlegm or anything like that, just put it in the little cup and we'll send that down. Okay. Oh. We're down be up. So I took on one. Where's the corridor? Is it in your bulk med? Nope, it's not in bulk meds.
Yeah, vomiting on that's in your 5.
Is that one OX? Okay, so then yeah, I might have a misfill from pharmacy. Okay, we'll call about the Protonics. You can go ahead and give him his azithromycin and his methylprednisolone. What's that one scare? Oh, it's at the bedside. I'll grab it for you. Redo my hands again. And here's the scanner. Thank you. I'm going to take a look at your IV.
Can you tell me your name and birthday again? Lewis Carter, XXXXXX.
Okay. How does your IV site feel?
It feels good.
Okay. Any swelling, tenderness? No. Okay. His IV site looks good.
That look like 1 ml?
Yep. 1 ml. Mm-hmm. Yep, we have a med kit right here. Mr. Lewis, do you have any difficulty swallowing?
No.
Nope. Okay. We've got your antibiotics scheduled to give you.
Okay. Yeah. So we got your antibiotic, which is the azithromycin, and then your solumetrol.
Okay. Mm-hmm. 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 Here. Once.
Wash it a little bit first. Need to have with its own financial.
Does that IV feel okay? Do you taste any like salt or metal?
Taste the saline.
Okay. That's a good sign. That's telling us where it's supposed to be.
Okay.
While you finish you doing your documentation on that med pass, I'm gonna go check on Miss Donna, okay? And then you can meet me there when you're done. Okay. All right. Well, I'll be right back. Bye, Lucky. Bye. As long as it's all right with you, I think I'm gonna help you out and put in the NG tube for Mr. That would be super helpful. Do you care to do that? I do not mind at all. Okay, take AO or CNA with us. Okay. And we will get started on that. Okay. I might send my orientee in too, just to watch because she mentioned not seeing one before. So that sounds great. Okay. Awesome. Hi, Mr. Kim. My name is Jill. I'm the charge nurse. I have Andrea, our CNA, and Rachel is an orientation nurse on the floor. Is it okay if we're all in the room while we get this NG tube inserted? Yeah, that's fine. Perfect. Can you tell me your name, date of birth? Andrew Kim, XXXXXX. Perfect. And do you have any allergies? No, yo. Awesome. So we have a provider order for you to put in a nasogastric tube. What that is a tube, thank you very much, that's going to be inserted through your nose and it goes down into your stomach. It's going to be a little uncomfortable, I will be honest with you, but we're going to be here with you, and I'll walk you through it every step of the way. First, do you have any history of oral traumas or facial traumas? No, nothing. Okay, perfect. And I'm just going to do my looking into my mirrors and see which one looks better. I'm going to go with the right side as long as that's okay with you. That's fine. Perfect. And then we'll do a quick abdominal and respiratory assessor. Does it matter what side you go on? It doesn't matter what side. I usually just prefer whatever side I'm on. I'm right-handed, so I'm on the right side of the bed. Okay. Being so I'm just gonna listen to your belly. Oh, your belly is distended. Yeah, anything's gotta be better than throwing up like this. Yes. No, just breathe normally. Perfect. And we'll sit you up here. And let's move back. All right, perfect. Back. So for this procedure, I'm gonna have you sit up nice and tall, and our aide is going to help. And whenever I insert this NG tube, I'm going to have you swallow. We have a cup of water here. And it's really important that you swallow, swallow, swallow on my cues so that way we can get this NG tube into your stomach, okay? If there's at any point where you need to stop or you need to take a break, you just let me know. Okay? Okay. All right. We've assessed our nerves. We've done our verification of surgery and traumas. So I think we are ready to get started. Can I put my gloves on? I already washed my hands. How would you know if that wasn't a lump? A lot of times the patient will start coughing, and we're always going to verify after we're done that it's in the right place he adjusts. Sorry about that. Okay, so first we're going to measure split earlobe and then down to the xiphoid process. So perfect. To cut this tape to mark the right tail. I will lubricate this up. Alrighty, and then we're going to have you sit nice and tall. Tuck your chin to your chest. And ready, on a count of three, we're going to have you start drinking that water, okay? Ready? 1, 2, 3. Swallow, swallow, swallow. Doing great. Keep swallowing. Right? For simulation purposes, we would go down all the way to where it's marked on the real patient, but this is a mannequin. This is as far as our mannequin will let us go. So anything else we need to assess during and after? Yes. So we're always going to be keeping an eye on their oxygen level. So we have a pulse ox on the patient. So we're keeping an eye on respiratory status the entire time we're inserting that too. How are you feeling, Mr. Kim? I feel okay. It's just kind of uncomfortable. I'm kind of worried it's going to come out. Right. Well, we will make sure and tape it down. I've got my handy tape here using my pants method. And we're going to put this right on your nose.
take it around. All right, perfect. Okay, that should stay nice and in place. Now we're going to make sure the patient's always sat up at 30 degrees at least. We'll get verification via chest x-ray that it is in the right place before we hook up to suction. So I'm just going to pin this to your gown. Just keep it out of the way for now. All right, we can take off your pulse ox now that the procedure is over. And then as always, we're going to document the size of the tube, so the fridge, how the patient tolerated it, and the depth, as well as the verification method that we used. You did a great job, Mr. Kim, and I've got your call light within reach in case you need anything in the meantime, all right?
Hi, Miss Donna, Lindsay. I'm back to pass your meds. How are we doing?
Oh, good. So just feeling super tired and heavy.
Tired and heavy. Okay, well, we are going to use some medicine to help with that. What you have, dude, is your diuretic, so that is your furosemide. We talked about that briefly earlier, and it's going to help just pull all the extra fluid off. Will help you with your breathing, and will help with the swelling in your legs as well.
Okay.
That's
I want to make the 11.
It does. It does. So we'll work on getting like a bedside commode, but please call me if you have to go to the restroom.
Will do.
Okay. Yeah, we need to keep an eye on your intake and output. So we'll get you the chart to document and the measuring hat as well. You also have your lisinopril. That's one of your home medications. That is your hypertension medication, and then your metoprolol. That one's for your CHS.
And then like recheck the blood pressure or anything.
Yeah, I think we should. Yes, we should recheck vitals. Do you want to recheck a set of vitals? Okay. So we'll recheck a set of vitals. Any questions on those two medications? And then I also have your daily baby aspirin too. All three of those are your home meds.
No, I know sometimes when I take them all together, they can make me a little dizzy. So just kind of pay attention to that. Okay.
Gotcha. Yeah, we'll definitely recheck some blood pressure, and we'll document your vitals before and after. So we'll be back to evaluate. Yes.
Successfully after NG2 and Mr. Kim, and it's been verified via X-ray. I saw orders for low airman wall suction, so I'm gonna go ahead and soak up your patient if that's okay.
That's perfect.
Notice that he is a diabetic. Would you like me to ask the CNA to get a sugar for you?
Yes, if you could do sugar, and then if he does need insulin, do you care to get that?
I sure will.
Okay, perfect. Thank you.
Like ring CNA? Yep. Could you come check a sugar on Mr. Andrew Kim in bed 10, please? Yes, I'll be right there. Thank you. What was his last blood pressure?
His last blood pressure her last blood pressure, yes, was 154/90. So it was pretty elevated before.
It's still right around there. Yeah.
It's still right around there. Okay.
It's 150 or 80 better.
Okay. So it's still a little elevated. It's 150 over 87. Okay. So we'll make sure we document that. So that is an okay level to go ahead and give these medications. But of course, we will do the evaluation in about an hour to make sure that your blood pressure is staying within range. But if you do feel lightheaded or dizzy or anything like that, please let us know.
Okay. Will do.
Okay. Sounds good.
I remember, like, with the Lasix, like, I had to watch it. Some sort of lot to, like, they honed it in.
Mm-hmm. Yes, potassium. So you'll definitely have to monitor her potassium. So she was 3.4. So it is on the lower end of normal, but like you had mentioned when we brainstormed earlier with all the excess fluid, it might just be a little diluted in her labs. But they usually go ahead and prescribe potassium as well. So yes, this physician did prescribe some oral potassium supplement to go in conjunction with the Lasix to help keep that at a normal range. Okay. Good questions. So we're going to go ahead and get the furosemide. You do have that. And then lisinopril. Oh, I do not have that. Do you care to go to the bulk meds on the other Pyxis and see if the lisinopril's over there? Okay, thank you. She's going to get the lisinopril. Then I have the metoprolol, which is 25 milligrams. Let's go ahead and see what pocket that is in. Drawer 6, pocket 2.
What was this shake? Obviously, look very a lot in her and me.
Oh, awesome. Thank you. And then I have the low pressor, the metoprolol. It's ordered for 25 milligrams, and we have a 50. So what are we going to have to do with that?
Got it.
Got it. Oh my god, I don't have a pill cutter either. We will have to get supplies. So we do have a 50 milligram tablet. We'll have to cut it in half to give you a dose of 25. Okay, I don't know if you normally have a whole pill at home.
Yeah, normally just one.
Okay. I know there's different manufacturers, but it does have the split in it, so that tells me it can be cut. And then your baby aspirin, let's pick that out. That is in drawer 2, pocket 4. And I'm baby aspirin. So I'd probably go ahead and give you the aspirin first, because that's, or do you prefer your chewable first, or do you want your ones that you swallow first?
I'll shake the chewable first until we can rinse it out.
Okay. Sounds good. Do you have any difficulty swallowing?
Yep.
Nope. Okay. All right. I'm going to scan your wristband. Can you verify your name and date of birth?
Donna, Reese, that's it.
Okay. And I have that you have an allergy. What is your allergy to?
I'm allergic to penicillin.
Penicillin. Okay. I am going to scan the aspirin. 81 milligrams. So we just need 1 tablet. You got the last tablet in that bottle.
Not good.
All right. So I'll go ahead and give you this, and then I'll give you your water to drink. Here you go. That is chewable. Okay. That's bad. Let's go ahead and give your Lasix. We have that here. Gonna go ahead and alcohol that. Now it's ordered for 40 milligrams IV push. And I have 40 milligrams and 4 mLs. So I'm going to draw up 4 mLs. Now, do you remember what we had to remember about our furosemide?
Oh yeah, that's the one that we said we had to the slow.
Yes. So we will push it slow. It is 10 milligrams per minute. So we'll have to push it over 4 minutes. So I do have my little clock in my pocket to watch for that. So I will keep an eye on that. I'm also going to flush her IV prior to make sure that it's still working properly. I'll move this over here just a little bit. All right, your meds here. And I'm going to scan your wristband, scan our med. Go there. And scan the flush. Scan 2 because I'm going to flush before and after. Okay, I'm going to go ahead and clean your IV. Gosh. Does that feel okay?
Yeah, that's fun.
It flushed great. So, Miss Donna, I do have to push this medication over a short period of time. So I will be hanging out with you for a little bit because I just had to push a little at a time over 4 minutes, okay?
Okay.
So what do you like to do for fun?
Usually just go out to dinner, hang out with my grandkids.
No, it's awesome.
How many grandkids do you have? 7. Oh my goodness. You know, all different ages, I assume. Yeah, they're all over the place. Lots of sports, lots of activities they're going to all the time. Yeah, they keep us busy, that's for sure.
4 minutes have passed. Now I'm going to flush it at the same rate that I push the medication. because I'm finishing pushing that medication through my pigtail.
Mr. Kim, can you tell me your name and date of birth? Andrew Kim, bye. Awesome. Are you allergic to anything? No.
Another 4 minutes of fast. Go ahead and place my sharps in the sharps container. All right, next, the last two that we have that are non-chewable is your lisinopril, 10 milligrams, and then your metoprolol, which is 25 milligrams.
Okay, that's under.
Scan your wristband. Verify your name and date of birth.
Louise, XX.
All right, do you have any questions on your medications? I know they're your home medications, so you probably know pretty much about them.
Yeah, I know I take these at home every day.
They're fine.
All right, look. I have this insulin. I'd love to double verify with you.
Yeah.
Alright. So we are out of the room, not giving patient information in the same row. Mr. Andrew Kim's blood sugar was 310. He has strict MPO, so he's going to be getting 5 units, and I have this 5 units, right?
Yes, perfect.
Perfect. I also saw that he has Photonics due, IV push. I'm going to give that for you as well.
Okay.
Was you okay with that?
Yes, I'm okay with that. Thank you so much.
Thank you.
All right, so we do have Ecfel Cutter here. Your lisinopril is your ACE inhibitor for hypertension and heart failure. Can cause a dry cough, so if you have that at all, just let me know, okay? And then we're going to keep monitoring your blood pressure with that. Same thing with the Lasix, because we're going to help pull off that fluid. And then for your metoprolol, that is your beta blocker to help with heart rate, blood pressure, and then the oxygen myocardial demand of your heart. So we'll also monitor your heart rate and blood pressure. So that's why we have the cardiac monitor on you. But also we'll do frequent vital sign checks as well. So I'm going to go ahead and cut this in half. So whenever you have a pill that you have to cut in half, you will waste the other half in the proper receptacle. Okay. Yeah. Clean cut. Okay. And then the lisinopril, which is 20 milligrams. Oh, it's actually 10 milligrams, and I have a 20 milligram tablet. So this one will also need to be cut in half. And it is scored, so it's telling me that it can be cut in half. If I had any questions, I could just ask pharmacy.
Yeah, this some can't be cut, or at least some can't be crushed, right?
Yeah, exactly. Do you know of any off the top of your head that we cannot cut or crush?
That Mason knife one that you can't crush?
Yes, here.
And get for all to wash.
Enteric-coated or like extended release, those kind of things. Okay. Clean cut. All right, so we do have a half of your lisinopril and a half of the metoprolol to get you the dose that you need. Here is that. I'll give you some water. Yeah. Thank you so much. All right, we'll be back in a little bit to recheck your blood pressure, but we'll continue to watch your heart rate and rhythm on the monitor, the screen out there.
I'll let you guys know when I have to back.
Yes, please do. Got your call in your hands. All right. We'll see you back in just a little bit, Miss Donna.
Thank you.
Thank you.
Okay, Mr. Kim, I know I'm going to next. I just reconstitute a friend. Okay, I never heard of that before. What is that? So Protonics is going to help with abdominal discomfort and reflux. Oh, that's great. Yes, I also had your insulin because your blood sugar was 310, so you're a little sweet. So we're going to give you a little bit of insulin, but we're making sure to give you a lower dose than if you were consuming minerals and carbohydrates that you have the NG tube and are strict MPO.
Okay, yeah, I normally get that shaky, clammy feeling.
Oh no, we definitely do not want that. So we're going to give you 5 units. So that should be just fine. If you start to feel shaky or anything, you just let me know. Can you tell me your name and date of birth again?
Andrew Kim, XXXXXXX.
Perfect. Any allergies?
No allergies.
Perfect. I have done all my medication checks. I verified my insulin with a second nurse. I've done all my rights, so we are ready to move on, okay?
Mm-hmm.
I'm going to give you your Protonics first. I've looked at the MAR to see the rate at which I can push this. I'm going to pause the pump so I can get this in your IV. I'm going to make sure that your IV is working well. Has it been bothering you? No. Perfect. Scanning my patient, scanning my meds. You have a scanner. Will we give anything? Okay. Here. Oh. Well, the alcohol. Let that dry. Does it hurt at all when I clutch your IV? No. Perfect. And here's your Protonics. Push this over the rate. Forward. Sit. And then I'm going to come back behind it and flush. You still feeling okay? Yeah. Perfect. And then we'll hook you back up to your fluids. Okay. Where would you like your insulin shot? I can give it to you in the back of your arm or I can give it to you in your abdomen. Either's fine. Okay? I'm just going to go for the back of your arm since I'm on this side of the bed. Okay? Great. Pinch.
Hi. We just got done with our other patients, so we decided to come in and check on ya.
Awesome.
How we doing, Miss Kim?
I'm doing okay.
Okay.
He just dies for times. I do push and then we get him this insulin, which he verified with Lee. So he should be all caught up on his meds. And his NG2 is up to low intermittent pulse suction. So he is good to go.
It's good to go.
Quick reassessment and we're good.
Okay, you feeling better, Mr. Kim?
Yeah, I'm feeling a lot better.
All right, good.